everyone. We are live at Aster CMI Hospital, Bangalore. The speaker for today is Dr. Srikantha, who is consultant interventional pediatric pulmonologist and speak specialist. Welcome, sir.
Good morning.
Coming to coronavirus or COVID-19, it is a respiratory tract infection basically caused by SARS-CoV-2 infection. It can be transferred either through respiratory droplets to direct contact with cases or even through certain uncontaminated surfaces. This virus is known to survive in surfaces for various periods of time, but it can be easily inactivated by chemical disinfectant. With the onset of Unlock 4.0, which has been introduced since 1st September, it has become really important for us to discuss about preventive measures that can be taken at home as well as at workplaces. So the topic for today is home and workplace sanitation. So Dr. Srikantha, could you share your insight as to what can be done at home as well as workplace for prevention of certain contamination?
Definitely. So today's topic will be home decontamination if there is a patient who has coronavirus in home isolation, as well as general preventive measures that can help in not only your home but also in your workplaces, so as to maximize your efficiency and minimize the risk of contracting a virus, as well as making sure that you do not become a super spreader among the community. So before we start the program, I would also want to give a few insights into the virus itself and mode of transmission and all those things. So basically, the virus is a beta coronavirus. So it's like any virus that is there in our community, and coronaviruses have been there in our community for a long time, probably thousands of years. And the most commonest coronavirus that everyone has had as a child or as an adult or as a adolescent is the common cold, which is usually caused by a coronavirus, but it is not severely infectious, and second, it is not severely debilitating as this particular coronavirus. Like I've already told you, there is alpha coronavirus, beta coronavirus, there's MERS coronavirus, and this particular COVID-19 belongs to a beta coronavirus. So this particular virus is a novel coronavirus, and that is the reason why they have named it as novel COVID-19 or novel SARS coronavirus 2. And depending on the virus itself, the infectivity of the virus can be before even the symptoms start. So imagine if I have infection and I am the one who is infected with the virus, I might not present or I might not manifest all the symptoms of the virus. That means even though I have virus in my body, even though my nose, my oral cavity is significantly carrying the virus, but I will not be symptomatic. The symptomatic period will be at least 2 to 3 days to max 5 days after I contract the virus, and I will be infectious even though I am not actively presenting any symptoms, and I will continue to be infectious until up to 10 days. So it can start from contracting the virus to infectivity period to complete resolution. Until that time, I will continue to be a person who will be a spreader or a super spreader. And coming to transmission of the virus usually happens through the respiratory droplet infection. So what are the respiratory droplet infections that we are talking about? So respiratory droplets can be produced when we cough, respiratory droplets can be produced when we sneeze, and respiratory droplets can be produced even when we talk. So even a conversation with your close colleagues, even a conversation at your office, even a conversation at home without you knowing you are carrying the virus can be a major reason for spreading the virus. And most importantly, without knowing that you are carrying the virus, coughing without respiratory etiquette. So what is a respiratory etiquette? Respiratory etiquette means you cough without your closed elbow, you cough without having a handkerchief to your mouth, can cause virus to spread. The reason being, where with a simple cough, with a simple sneeze, the virus can travel at least 6 feet into the atmosphere, and it forms a respiratory cloud, and the respiratory droplet will be suspended in the air for a significant amount of time. So definitely something that needs to be considered in your workplace as well as your home. Apart from that, risk of transmission. I've already told you risk of transmission is something that a person will have at least up to 10 days after contracting the virus. So even before me knowing that I have a virus in my body, I will continue to be transmitting virus to others. So we call it as incubation period, and incubation period for the virus has been touted to be between 7 days to 14 days. But usually it has been, at least in studies, told that at least 5 days, 5.8 days before I actually contract the virus, actually start become symptomatic, I will continue to have the virus in my body, and I'll be spreading the virus in my body. And apart from that, most important thing that everybody here would want to know is about environmental contamination. Environmental contamination is something that we have to look at, particularly in offices, play schools, if the schools are going to reopen the next, the malls which have already reopened, lot of factories have reopened, and these things have to be made sure, because environmental contamination can happen anywhere. So what are the usual environments that we look at? So I would open and close a doorknob a few times. I would not only open and close doorknobs few times, I will also touch a few things very frequently. And after touching those things so frequently, the first thing that we usually do is we try to rubberize, we try to kind of clean our face. So per day, it is we usually touch our face at least 200 times. And you can imagine there is potentially 200 times that you can actually come in contact with the virus. So environmental contamination is the number one reason for spreading the virus, apart from our respiratory droplet. So it can be present in your doorknobs, it can be present in your handrails, it can be present in multiple places. So environmental contamination has to be taken care of. And the reason why you need to take care of environmental contamination is because the virus is present on those surfaces for a few days without dying. Even though we have not been able to culture them in the culture media by taking swabs from them, but doesn't mean that the virus will not cause the same effect in the body. So these things have to be taken care of. So I have given an overview of the virus. I have given you about the transmissibility, I have given you about the period of infectivity, I have spoken about the environmental contamination. So this is a small paragraph about how the virus is, what the virus is, how the virus is spreading, and how better we can take care of the virus.
So now the issue arises that many workplaces are opening up. So what are the preventive measures which should be taken from the employee side as well as from the employer's side in order to prevent transmission?
Absolutely. So basically, the whole scope of today's talk will be four most important points here. So the first point that I would want to impress upon to all viewers is generic preventive measures to be followed at all times. So this is the most important thing, and as we all know, there is no one good cure for coronavirus, and the only way that we can prevent ourselves and our dear ones and our colleagues is by doing generic preventive measures at all times. I'm going to come to what are generic preventive measures. But apart from that, there are measures which are specific to offices, there are measures which are specific to home, as well as what if there is an occurrence of case that happens. So these are all the most commonest things that I will be touching upon now. So when we come to generic preventive measures, so generic preventive measures at all time consists of a few things. What are the generic preventive measures? Generic preventive measures will be, first thing will be mostly hand sanitization. So hand sanitization has to be done anywhere and everywhere, and hand sanitization consists of two things. One is washing your hands with soap and water for at least 20 seconds. So 20 seconds is a minimum time, because it takes 20 seconds of time for any virus on any contact surface to die. And if it is dirty, then definitely hand wash. If it isn't dirty, then you can just sanitize your hands. And again, sanitization of your hands will be with a sanitizer which has 70% alcohol. So that is very, very important. People ask us about a lot of questions about, can we use sanitizer which doesn't have alcohol? Can we use sanitizers which has a little bit of more perfume smell? Again, we say you please use whatever you want to, but at the end of the day, it has to have 70% alcohol content inside it. And it is definitely safe, you don't need to be worried about. The second thing that we usually want is minimum distance. So you need to maintain a minimum distance of 6 feet. So no matter where, no matter what, you have to maintain a minimum distance of 6 feet. Let it be office space, let it be a public space, let it be the public transportation that you're taking. So minimum distance that you need to maintain is 6 feet. The reason why you need to maintain a minimum of 6 feet is, even though I inadvertently cough or sneeze, it can travel only for so much distance, that is 6 feet. Beyond that, usually it doesn't happen. So you need to be very careful that you always maintain a minimum distance of 6 feet. Apart from that, always wear a face mask. So a face mask is a must. So anybody and everybody who is going to work or who is going into a public space has to wear a face mask. It doesn't have to be a N95 mask, which was used very, very robustly during the start of the pandemic. It can be just a simple face mask, a triple layered surgical mask, or even a face mask that can be just a handkerchief that can be worn, can be used to make sure that anybody who coughs or sneezes doesn't come back and cause significant amount of soiling your face and your eyes. Apart from that, respiratory etiquette to be strictly followed. This involves strict practice of covering one's mouth and nose while coughing, sneezing with tissue, handkerchief, flexed elbow, and disposing of used tissue properly. So this is a very, very, very important thing. We've seen children doing that, we've seen adults doing that. They just cough and sneeze, they just do not understand what is respiratory etiquette. So this has to be literally poured inside their mind that whenever they do, they have to flex their elbow if they do not have a hand key or they do not have a tissue, and make sure that the tissue is put into a dustbin as soon as possible, and make sure you sanitize your hand immediately. And most importantly, you are responsible for your own health. So self-monitoring of health is very, very important, and reporting any illness at the earliest to immediate supervisor officer. Let it be at home, let it be at home, it can be your loved ones, it can be in your office to your supervisor officer. Please make sure that happens. And at last, the general preventive measure is spitting shall be strictly prohibited. You can see people driving their motorcycles spitting on the roads, people standing on footpath and spitting on the roads. That is something that is a reason for super spreading. It is not only now, it is being touted to be number one reason even for tuberculosis, and that is the reason why it has been brought out into media now with actors endorsing advertisements for not spitting. You could have watched that Akshay Kumar comes on the screen saying "Thuk Chan, Thuk Chan." So it's very, very important. So these are some of the generic measures that I would want everybody to follow, no matter where they are. Yes, in the houses, when you know your loved ones and dear ones do not have any problems, definitely you can mingle with them without any problems. But at the same time, please maintain a strict protocol at home also to wash your hands a bit more frequently. You do it, your children do it. Your children do it at home, they go and do it at their schools. Again, it just keeps snowballing everywhere so that everybody comes into the same domain, so as to make sure that everybody does the same and make sure that this particular pandemic has been reasonably controlled. Now, coming to specific measures for offices. So this is a very important thing. This has to be followed in most of the offices. Now that we are seeing a lot of offices opening to full strength, a lot of people coming back from their homes into a new environment where they're not only scared to enter the office, but they're also scared that they might carry the virus back home and give it to their loved ones and dear ones. So it has to be mandated that these steps are carried out everywhere. So first thing will be entrance to have mandatory hand hygiene, that is sanitizer dispenser. So now you can see most of the offices, most of the malls, most of the places have a hand dispenser or a dispenser where you just have to press it with your leg and the sanitizer comes out and you just wash your hand or sanitize your hand, and there will be thermal check screening provisions that has to be provided before any person enters the particular office space. And second most important thing will be only asymptomatic staff or visitors should be allowed. You just cannot allow each and everyone without knowing if they have symptoms. So what we have seen in hospitals at least is parents come, child has fever, parents also have fever, and they keep mingling with every other patient. So we have people who just come for vaccination, we have people who come for flu clinic. So we have segregated them and made sure only people who come for those specific things are allowed in those specific domains rather than intermingling. So very, very important. The third thing is, because bus services are being started now, let it be public service, let it be a private service, drivers should maintain a social distance and shall follow required do's and don'ts related to COVID-19. That is social distancing, cleaning their buses before and after they have dropped the people, cleaning it with 1% hypochlorite solution or spray, and making sure that they use a proper disinfection for steering, doors, keys, etc. That has to be made sure. And because they are the captains of the buses, make sure that everybody who boards the bus always wears the mask during and even when they are getting down, so as to make sure that they do not transmit the virus, because what you bring is what you get. And most important, advise all employees who are at risk, that is older employees, this is very important point, older employees more than 65 years, pregnant employees who have underlying medical conditions, to take extra precautions. Make sure that they are, because they are not exposed to any frontline work, so do not give them the frontline desk jobs. Do not give them jobs which needs them to come in contact with too many people, so as to make sure that they do not get the virus so easily. And the office management has to facilitate so that they can work as much as possible from home. If definitely not possible, then whatever I've told you has to be taken care of. Apart from that, all officers, staff, visitors allowed one entry and one exit only, and make sure that those hospital, the people who are coming in has one single point of contact. That is very, very important. One single point of contact is very important. They just cannot come into the office space and meet everybody as they were meeting previously and just keep going around meeting people, greeting people. So when they come inside the office, they should come in contact with only one person, and there is a designate one particular person who will look into it. Routine issue of visitors, temporary passes should be suspended, and visitors with proper permission of the officer who they want to meet should be allowed after being properly screened. That is a must. Meetings, as far as possible, should be done through video conferencing, and video conferencing is here to stay, not only for now. Even when vaccine comes, we do not know how fast the vaccine is going to come, how effective the vaccine is going to be, and before that even happens, we need to be careful about a combined meeting. So we just cannot have an indoor meeting with too many people. So that is the reason why government has made sure that we should not have a meeting with significantly large number of people. And if it can be done outdoors, please do it outdoor, because the stream of current which flows through will carry the virus. If you're sitting under the sun, the UVB rays can desensitize the virus as well as kill the virus by the UVB. And if that is not possible, then video conferencing is the way moving forward. Posters, standees, AV media on preventive measures about the COVID-19 to be displayed prominently. So as soon as the employee enters, he hand sanitizes, he has his temperature checked, you have a standee saying that take all these preventive measures to make sure you don't take back the virus to your house. and make sure that you do not give the virus even to your employees, fellow employees. Apart from that, if they are working on their laptops, have screensavers which will say that how to prevent virus, what do you do if you have the symptoms as soon as possible. So these have to be banned. Staggering of office hours, lunch hour, that is office hours, lunch hours, coffee breaks to be done as far as possible. So you just cannot let everybody come in at a particular time, and you can't allow the same things that they were doing, sipping coffee and gossiping, sipping coffee and sharing thoughts. No, that cannot be allowed. It has to be staggered. Let it be office hours, let it be lunch hours, let it be coffee breaks, and it has to be maintained, and it has to be made sure that employees understand that they have to do this. Employees have to be taken into consideration before formulating these plans, and employees have to be stakeholders. Until unless you don't make them stakeholders, they are never going to understand how difficult it is and how things are being planned. Proper crowd management in the parking lots and outside the premises, duly following social distancing norms has to be ensured. So you just once you leave the office hours, you just go outside, because you're not able to do the same thing at the office. You just don't do the same thing in your parking lots. That's all. That is also something that has to be made sure taken care of. And apart from that, any shops, stalls, cafeterias, because we have a lot of shops and stalls inside offices, they have to be taken care of and made sure these have proper social distancing norms at all times. Specific markings may be made with sufficient distance to manage queues and ensure social distancing in the premises. So what we have told a lot of schools, what we are doing even in a lot of places, is mark those places and put their names on those marked places, so as to the person know that that is his place and he is not going to venture out into others places, and person follows those rules a little bit more regularly, so as to make sure that social distancing norms are maintained. Preferably separate entry and exit for officers, staffs and visitors shall be organized. And again, very, very important, you cannot have people entering and exiting the same through the same office outlet, because again, too many people saying hi, bye will again cause significant amount of overcrowding. And again, like I've already told you, just speaking can transmit viruses. Proper cleaning and the frequent sanitation of workplace, particularly of frequently touched surfaces, must be ensured. So what are the frequently touched surfaces? It can be the pen, it can be the laptop, it can be the doorknobs, it can be the handrails, it can be the windows, it can be the doors, it can be anything in the office, and we call them as high contact surfaces. Anything that is that a person touches more than a few times is all called as high contact, and these are the places which actually cause significant amount of virus to spread among people, and they have to be cleaned. So always clean from a cleaner area to a non-cleaner area. Always use 1% sodium hypochlorite solution. So we have ways to do it. So what are the ways we do it? So we have bleaching powder, that is the cheapest. So you take 7 grams of bleaching powder, add to 1% of 1000 ml of water, you get 1% hypochlorite solution. You have others like chloramine powder, you have the bleaching tablets. So there are different compositions to it, and you need to make sure that you use it accordingly, and those things have to be cleaned a bit more frequently. So how do we clean it? So before office hours, everything has to be cleaned with soap and water, and that has to be sanitized with 1% hypochlorite solution. So everything, so from your floors to your cabins to your computers to your, so 1% hypochlorite solution for things which are compatible with it. And if they are not compatible with it, please use alcohol-based sanitizers. So alcohol-based sanitizers can be used for your keys, it can be used to clean your laptops, it can be used to clean your phones, it can be used to clean doorknobs. So anything that is compatible with it will be cleaned by your alcohol solutions. Anything that are not compatible will be cleaned by soap and water, and then sanitized with 1% hypochlorite solution. So these have to be taken care of. That next comes the sanitization of your toilets. So public toilets, definitely most important source. Time and again, virus has been found in stools, virus has been found in urine samples. So it doesn't mean that it is going to transmit, but it has to be made sure they are sanitized appropriately. So you have to give your sanitization workers appropriate equipments before they start cleaning. They need to have heavy duty gloves, they have to have heavy duty boots, they need to cover themselves with a plastic apron, wear a proper mask. Again, they have to use separate brushes for the commodes, the toilet seats, as well as separate brushes for the sinks. Everything has to be taken care of, and again, they have to be washed with soap and water individually, and then sprayed with 1% hypochlorite solution so as to disinfect every place, every nook and corner, so as to not transmit the virus in the public places. And then coming to the canteen, again, very, very important. Canteen also has to be made sure. So before cooking the food, the person who actually cooks the food has to hand sanitize, wash the hands, and after cooking again has to hand sanitize. Adequate crowd management and queue management has to be ensured to make sure that social distancing norms are maintained. Staffs, waiters, or persons who serve you food always has to wear a mask and hand glove and take the other required precautionary measures. The seating arrangements to make sure the distance of at least 1 meter between patrons are made sure as feasible as possible, and in the kitchen, staff to follow social distancing norms. So everything has to be done. So I hope I have covered most of the things which actually is going to make your office space or any factory reasonable to not only open to work without any major hassles. So again, most important thing is having a dispenser, that is hand sanitizer, at every point so as to not go out and look for it. And definitely you don't need to carry your sanitizers, because you carry your sanitizers, you would have touched surfaces, you will go to your pockets, you will open the sanitizer, you will put it on, again you touched your pocket, so that is again soiled, and by that you can again go and contract the virus and again keep touching everything. So definitely something that I would want you to do, that is have hand sanitizers in places that are not only feasible but also in multiple places, so as to make sure that the employees do not go in search of it. You can have wall mounted ones, you can have the dispensers with the dispenser by pressing the foot pedal. So any type of hand sanitizers are perfectly fine. And coming to last but not the least, fumigation. Again, fumigation can be done at your workplaces. Fumigation can be done every 3 days, even though people say it has to be done every day. Fumigation is an excellent option, and fumigation every 3 days is wonderful in making sure that the viruses are killed and your workspace is completely normal. So please make sure that you do all these things and make sure that your the workplace is sterile and your employees are not scared of the virus, because they are taking all the precautionary measures from mask to hand sanitization to cleaning their hands, washing their hands frequently, to making sure that they do not come to office when they fall sick. So this covers most of it, and
Yes, I think we've covered most of the points which are important. Now the issue is that as the cases are rising, what preventive measures can be taken at home when a person is COVID, when a family member is COVID positive?
Right. So now we can see that, like Dr. Lina has already spoken to us, that cases are rising, and we are seeing a lot of them having either asymptomatic or mildly symptomatic, and most of them are being home quarantined. So if there is a case, if there is a person who has contracted virus in your house, and I know you do not want to contract the virus, at the same time you also want to care for that particular person, you need to make sure that you do all these measures at home so as to not contract the virus, At the same time, care for the loved ones so as to make sure that the things go on smoothly without any problems. The first thing that you need to do is please house the person who has contracted the virus in a well ventilated separate room, which will have its open windows and an open door. Because, like I've already told you, a current of air which passes from one room to another room or through open spaces is going to carry the virus out. If that can be done, it will be definitely something that is feasible and something that has to be propagated. And most importantly, if you do not have a separate room, and say imagine you stay in a one room, one bedroom house, you stay in a house which doesn't have a significant amount of space, in that case please make sure you maintain a distance of minimum 1 meter from the patient at all time. That is a very, very important thing. Second thing is movement of patient has to be limited from a shared space. So imagine you have a patient at home, you please make sure the patient doesn't come to shared spaces. What are the shared spaces? It can be in your living room, it can be kitchen, which will be used multiple times by you for cooking the food, for watching television, for doing something like working from home. So that place should not be contaminated. So please limit the place that the person is going to. So limit the person to just a single room with a window which can help in ventilation. Yes, you can close the door of that particular room because you do not want the virus to come into the open space. But if you can open and whole house is cross ventilated, then you should not be really worried about. The fourth thing is, do you have any caregiver at home who can care for the person who has ill health? So imagine you have a 60-year-old person who has contracted the virus, and you also have a 20-year-old healthy adult who has no other comorbidity. In that case, that particular 20-year-old adult can take care of the patient because A, he doesn't have any comorbidities. B, the contraction of the virus in that particular person will usually go away as asymptomatic, or even if they are mildly symptomatic, they are not going to have many problems. But imagine if there is a person who's taking care and that person has other comorbidities like diabetes, cardiac disease, so they will have a high risk of having complications. So if something can that be done at home, it will be perfectly fine. And apart from that, make sure that the patient is you performing hand hygiene regularly. So no matter how, make sure that the particular person is using soap and water, hand sanitizing. If it is dirty, wash your hands with soap and water. If it is not visibly dirty, then make sure that they sanitize their hands with hand sanitizer. A separate hand sanitizer has to be kept for the patient in the room that they are going to stay. So each of this step is definitely going to make sure that the person is not going to give the virus to other. Use of disposable paper towel to dry your hands. So make sure you keep enough amount of supply in that particular room so as to dry their hands frequently. If there are no enough paper towels, you can have cloth towels, but those cloth towels has to be frequently washed. You cannot have a cloth towel which is kept inside the room for a day and thinking that that particular cloth towel is reasonably good enough. It has to be washed a bit more frequently, and sometimes you might have to wash it every time the particular patient uses. Patient as well as caregivers have to wear a mask as much as possible. I know it is difficult, I know it is something that people are not used to, but now that we are into almost 7 to 8 months into pandemic, we are getting used to it. We have children at age 1.5 years who are comfortable wearing a mask now, and they make sure they will wear a mask before stepping outside. When a 1.5-year-old child can do it, why can't a 50 or 60-year-old adult do it? So definitely something that has to be stressed. Materials covered, used to cover the mouth and has to be discarded. So definitely something that you need to make sure. You just cannot keep using the same mask for days together. So you wear it, you use it for a certain period of time. If you feel the respiratory secretions are significantly causing the mask to get wet, or you think that the particular person is coughing and sneezing a lot and the whole thing is getting wet, so make sure that you dispose it, take it out more frequently, either wash it in a clean way, or dispose it in a bag which is meant only for that particular person. So you cannot bring it to the living area and put your dustbin into it and throw it away. So no, it is going to cause a lot more problems to you. So mask have to be not only handled properly, mask have to be discarded properly. So wearing a mask is very important. Wearing a mask, it's also an art. You have to wear it properly so that the fleets are facing outside. It has to cover from your nostril, that is the hard part of your nose, until the lower area of your chin, and mask has to cover the whole mouth completely, so as to make sure that whenever you talk, there is no space that is exposed to the area. When you sneeze or cough, it is not coming out. Apart from that, making sure that the area, when it gets soiled, you throw it away, you do not disinfect it. So everything has to be maintained. Apart from that, if you are going and cleaning the clothes and bed linen or the hand towels, make sure you use your laundry soap and water, and if it is machine wash, it has to be 60 to 90 degree centigrade hot water with household detergent, which is perfectly fine, and followed by drying thoroughly. A contaminated linen into a dry bag. So imagine if you washed it already and you dried it, and the person has used it and it is completely soiled. So you do not take the soiled one. If it can be disposed of, please dispose it off. If you are not able to dispose it off, make sure that it is washed appropriately with all proper measures. So you need to make sure that you are wearing a mask, you are wearing a proper glove, you are wearing a proper apron, and you're putting them into very hot water and drying it off. So everything has to be made sure, and cleaning plays a very important role. So do use gloves, do use protective clothing when cleaning surfaces, handling clothing or linen soil with body fluids, and depending on the context, either utility or depending on the utility, either a single use glove can be used, or a washable glove like heavy duty gloves can be used. But when you are talking about house, the single use glove is reasonably good enough. After use, utility gloves should be cleaned with soap and water and decontaminated, particularly if you are using a heavy duty with 1% hypochlorite solution. Single use gloves have to be discarded appropriately. Perform hand hygiene before putting and on or after removing the gloves. So imagine you've done every cleaning of it. Before taking it off, again perform hand hygiene, take your gloves off and then put it off. So everything has to be met. And then about cooking the food for the particular person, so please wash your hands before you cook the food, and again wash your hands after you cook the food. The person who you have cooked the food for has his own utensil, has to have his own water bottle, has to have his own soap and water detergent, so that is soap and water, to make sure that he cleans them and he keeps it ready for his next meal, so as to not contaminate every other surface. So we have covered from how do we sanitize the home, how do we sanitize how do we make sure that the person who has infection sanitizes himself frequently, to how do we take care about the home per se, then the laundries, then the soil linens, to food preparation, and at last but not the least, again toilet. I've already spoken about cleaning of toilets in public toilets. The same steps carry over here also. Cleaning toilets at home also is a very important step. So separate brushes have to be used for the sink as well as the commodes. Sink brushes should not be contaminated with your toilet commode brushes. Has to be cleaned with soap and water first, and then sprayed on with 1% hypochlorite solution. I already told you how to make the cheapest hypochlorite solution by using 7 grams of bleaching powder with 1 liter of water, which is going to give you 1% hypochlorite solution, which is perfectly fine for you to spray any surface of the house, barring a few things like keys, doorknobs, which has to be cleaned with your alcohol solutions. So with this, I think we've covered most of the workplace as well as home sanitization measures.
There are a few questions from the viewers' side. One thing is that during these COVID times, going to the hospital has become inevitable. So, what are the measures that can be taken while going to the hospital? Anything that?
Right. So, see, everybody knows We are admitting cases in hospital. We have plenty of cases in hospital, and we do not know who is carrying the virus and who is not carrying the virus. So in that case, if you have to get your child, please make sure you put on a face mask. That is the first important thing. Again, reiterating, preventive measure, generic measures are here to stay, are the only ways to prevent virus. Maintain a 6 feet distance. Just because you've gone to the hospital doesn't mean that you can wander away, you can go to a coffee shop, you can go to here, there. So anywhere you go, please maintain a 6 feet distance. Wear a face mask all the time. Not only you, not only your loved ones and dear ones. Please also make sure you put on a face mask. Believe me, children are very good if you put on a face mask and make sure you comply to it. You do not comply to it, your children do not comply to it. So I have a 1.5-year-old son who, when I put on a face mask, he knows I'm going outside, and he also wants to put on the face mask, and he doesn't remove the face mask. So please make sure you put on the face mask and hand sanitize. So hand sanitization is extremely important. So you come to the hospital, you imagine you touch something, touch surface, please hand sanitize, absolutely fine. So you keep hand sanitizing as frequently as possible in the hospital, and as soon as you leave the hospital, I think that is perfectly fine. And taking these simple preventive measures is the way moving forward. We do not have cure for it until now, and it is going to take a little longer time. So do follow generic preventive measures, and please no spitting on the roads.
Thank you. I think time is up and it's time to wrap up the session. I hope all the questions have been answered. If there's any further queries, please feel free to comment in the session below.
So thank you. Thanks a lot.
Thank you.